1 out of 5 women in India suffer from polycystic ovary syndrome. PCOS affects millions of women of reproductive age in India and is the leading cause of infertility. Hi, I'm Sania Mirza, and I take privilege to welcome Dr. Chaitanya, a renowned health expert who will offer practical strategies to empower women in managing PCOS complications. Raising awareness about PCOS can greatly benefit women due to the numerous myths and misconceptions surrounding the condition. Doctor, can you enlighten us on how a balanced portion control meal can positively impact a PCOS patient?
It's a good question. If you see, about 40 to 50% of women with PCOS also have obesity. So there is a very close relationship between obesity and PCOS. And when it comes to obesity, obviously losing weight becomes a very important aspect that is going to have a positive impact on the PCOS profile. So when I say weight reduction, it obviously comes to the diet and the exercise. So if you have an correct diet, that's going to help us in reducing the weight. So when I say correct diet, it's what you eat, how much you eat, and when you eat. All the three things are very important. So you have to have small portions, you have to have maybe frequent meals, and the way in which you are having the food is also important. So the sequence is also very important. Now when it comes to food, it's a very completely different science, and therefore I always suggest that we should have a dietitian on board when we are dealing with women with PCOS, and all women with PCOS should have a dietary consultation and stick to the recommendations which have been given by the dietitian.
Thanks, doctor. Can you also share how crucial is physical activity in the management of PCOS?
So as we discussed that weight reduction becomes a very important aspect when it comes to PCOS women who are overweight or obese. Weight reduction is achieved by two things. One, the diet, which I just answered in the previous question, and the second one is the exercise. So regular exercise is a very important feature for reducing the weight. Now it is said or recommended that about 60 minutes per day of exercise should be done by all women who are overweight or obese and having PCOS. So when it comes to the exercise, it is the exercise which will burn your calories, and it's not only the one which burns your calories, but also some muscle training is equally important. So just going for a walk or just that's not important. So again, here I suggest that we should have a physiotherapist on board when we are going to treat women with PCOS. She should be counseled by a physiotherapist, and the physiotherapist will keep monitoring her weight. Crash diet or crash exercise, crash reduction in the weight, which is something not advised medically. Therefore, there has to be a pattern in which the weight reduction should take place, and that's where the physiotherapist plays a very important role. So it's a teamwork when it comes to dealing with PCOS. It's not only the clinician which is important, but all these other consultants are also equally important. So along with the clinicians, there should be a dietitian, there should be a physiotherapist who will guide her to reduce the weight, and that's going to have a positive impact on the PCOS profile of a woman.
Thanks, doctor. One more question. What are the important parameters to be regularly monitored in PCOS patients?
That's a very good question again, Sania. We just talked about the diet and the exercise, which are an important aspect of managing PCOS. But it's also important for us to understand that it's a journey. It's not a one-time thing which should be done or will be done with the woman. So we have to handhold the woman, and we also have to walk along with her in this journey of managing the PCOS. And along the path, we need to see how she is responding to our medical management or the diet and the exercise which we are giving her to manage her weight as well. So PCOS affects different aspects of our health, and that's the reason why we need to monitor her on the way of reducing the burden of PCOS. Like these women are more prone to develop blood pressure. Therefore, we need to monitor her blood pressure on a regular basis. These women are more prone to develop diabetes or gestational diabetes. Therefore, blood sugars need to be monitored. Now we are discussing about the weight reduction. So when it comes to weight reduction, obviously I need to monitor her body mass index at regular intervals as well. One of the very important aspects of this is that because of the body image, many times these women are exposed to depression, and we need to understand this. And there is a different way of knowing whether she is likely to be depressed because of this, and whether she needs any help from a psychologist or a psychiatrist. So there is a system which is present, and we have to use that system to know whether she is suffering from depression. If you find that she is, then she should be counseled and refer to again a psychologist or a psychiatrist for the further management. Again, if she is referred to a psychologist, her response to that treatment or management needs to be assessed on a regular basis. So there are many aspects which we need to monitor as we go along with her in her journey to manage the PCOS.
Doctor, the clear message for all women is that meal, movement and monitoring are pivotal in managing PCOS for the benefit of women and society at large. Thank you, Dr. Chaitanya, for your valuable insights which can be vital for effective management of PCOS. As an athlete myself, I recognize the importance of lifestyle management for a healthier tomorrow. Together, we can break the stigma, spread awareness, and support each other in this journey towards better health and well-being.